If I was to have a dollar for every time that I heard, right? That's a famous quote that people often use, right? But what if I had a dollar for every time that I heard that there's no money in health? And there's a lot of people that use that terminology, and a lot of people in the health industry have heard that terminology countless times. And what if I tell you there is a lot of wealth in health? There might not be money and funds for specific groups or the groups that are in bed together, but there's a lot of wealth in health when it comes to families, when it comes to communities, when it comes to employers, when it comes to society. There's a lot of wealth in health when it comes to longevity, when it comes to the parents and the fathers and the mothers and the nonas and the nonos and abuelas and abuelos and grandmothers and grandfather living longer, to be vibrantly longer, to being around their family, or those that prosper within communities. You don't think a healthier community is more vibrant for society? You don't think a more healthier workforce is better for the employers and employees alike? Isn't it better for customer service? It is proven statistically that those that are healthy and within, whether it's communities or societies or workforces or family, that everything around them prospers, right? Because it multiplies. And that's where there's wealth in health, right? And beyond that, I heard a novel idea the other day about what if insurance groups, whether private or public, government insurance group, start covering healthy things like food, or start covering healthy, there's institutions out there that you can go there for a 21-day fast, for example. 21 months probably cure a lot of things. But a 21-day fast, the 14-day fast, or those types of private clinics that have hundreds of thousands of files where they've reversed, whether it's cardiovascular or diabetes or chronic illnesses or cancers, right? And they have done so, but people pay out of pocket primarily for those kind of service. What if the public, private, governmental type insurance were to share the pot, the taxation pot, the people's pot? What if we were to share that and say, you know what, we're gonna cover healthy food or organic food or healthy, proven, with, like, you can't argue the science behind the institutions that have reversed illnesses, instead of putting everybody on that same path of medication and medical procedures and often dying longer, right? So there is wealth in health. It's just that we need to change the mindset, and we need to remove the reins from those that control the pot of the people's money. Jean-Guy Bourguignon, Jean-Guy Public Communicator.